why am I just learning this now?
Yeah.
Right? Like, why, if this was so doable for
Yeah.
me, one of the participants of the program, she had type 2 diabetes, high cholesterol, and high blood pressure. And by the end of the program, she was able to come off of her cholesterol medicine. Her doctor said that she was really close to coming off of her diabetes medicine. It's kind of amazing that, after years and decades of people struggling with things, that then they start making these changes and they're so empowered. And so many of the people that have gone through my program, then they've said, like, why am I just learning this now?
Yeah.
Right? Like, why, if this was so doable for
Yeah.
me,
Yeah.
why am I just learning this now?
On today's episode of Empowered in Health, I have Dr. Saluja-Sharma here. She is a double board certified physician in emergency medicine and lifestyle medicine. And she has this incredible story of going from a lot of ER work, working in emergency medicine, all the way over to more of the functional side, lifestyle side, helping families, helping kids with really understanding the power of nutrition and so much more. So Dr. Saluja-Sharma, thank you so much for being here. I'm so excited to chat.
Thank you so much for having me. I'm excited to be here and to talk with you.
Yeah, it's going to be just insightful. And, we were talking a little bit before we hit record today about just your journey. And so I kind of wanted to start there of you really explaining, you spent years working in emergency medicine and then you slowly shifted over to more lifestyle medicine. I'd love for you to talk a little bit about just what that journey has looked like and maybe what the turning point was for you when you realized, I want to do a little bit more than what I'm doing right now, ER wise.
Absolutely. So I am an emergency room physician. I've been practicing on the front lines of our healthcare system in the ER as an ER doctor for over 20 years. And throughout the time that I've been practicing, it's something that I have noticed that our healthcare system sort of prioritizes disease management over disease prevention and reversal. And so every day, every shift, all day long, I see patients coming in with symptoms or with diseases that can potentially have been prevented and often could be reversed. And so this was something that was always kind of on my radar, that I always had the thought that I wanted to potentially do more and look at health through a more holistic lens.
Yeah.
About 5 years ago, I started having my own health journey where I wasn't feeling well, and I, was tired and I was dizzy and I just wasn't feeling my best. And for my own self, I felt like I wasn't really getting answers or help from our healthcare system to really help me feel my best. It was more about symptom management, and that's what really led me to then delve into lifestyle medicine and functional medicine. And I started to do a bunch of coursework in those fields. And it was eye-opening for me, honestly. Like, so as a physician that has practiced, at that point, I'd been practicing for over 15 years in the ER and, medical school and residency. It was amazing when I started doing this work in functional medicine and lifestyle medicine, how much I didn't know and how eye-opening it was for me. And so immediately I started making changes to my own life, to my lifestyle, my sleep, my diet, my stress management, my physical activity, and thinking about root causes of why I might not be feeling my best, and making changes. And it really transformed my own health, my own life. And that's when I really kind of made the decision that, like, I really need to share this with other people, because
Yes.
if this has been so powerful for me, then I think my patients, all of my patients, could benefit from this. And so this is when I actually started initially working with individuals. So coaching individuals, helping people to lower their blood pressure and their cholesterol and reverse their prediabetes and come off of medications. And the work was rewarding, and, people were really benefiting. But I also found that it's only a very small demographic that can access coaching and lifestyle medicine and functional medicine, because most of that is not reimbursed by insurance. And then I would go to work in the ER and I would see that all of my patients needed this help.
Yeah.
And so that's when I expanded and I started doing corporate wellness. And the first company I worked with was a construction company, helping people who wouldn't potentially have had access to this type of help and helping them change their life. And for many people, it was really transformative and a life-changing experience for them. And they felt so much better. And then I've since then been working with other companies and then school systems. And then over the past few years, working with school systems then inspired me to expand my reach to kids, because for many of the teachers and principals and bus drivers that went through my program that experience life-changing transformations in their health, they wondered how they could help their students. And so this led me to most recently create a series of children's books. It's a book, a workbook, and a cookbook to teach kids the essentials of nutrition, to help them create a positive foundation on how they see food, and to give them the tools and their family, their parents, the tools to make positive, meaningful change that can change potentially the trajectory of their health and their life.
Yeah, it's so many amazing nuggets that I want to kind of recall. And I just love hearing your journey. And I think it's something that a lot of people can resonate with, is just like, you were taught one thing and then you kind of started to experience some new different things in your own health journey. And it kind of was this shift and wake up call to, wow, I needed to learn new things. I need to get educated in a new way. So I kind of want to start there. I know one of the things you mentioned was, once you started to kind of dive into lifestyle medicine and the functional side of things, there were some wake up calls, if you will, of things that you didn't necessarily learn in emergency medicine, in the medical field, right? In healthcare. Talk a little bit about what those things were. Like, what were the major differences that you started to learn?
Absolutely. So really looking at why. So in medical school and as an ER doctor, my focus was on diagnosing and treating, right?
Yeah.
So people would have symptoms, I would diagnose them, and then I would treat them. But not really going back in time and asking why. Why did this happen? And then once you understand the why, then the how becomes more clear. Well, how can we prevent this from happening? How can we reverse this? And so really looking at health from that why perspective, looking at root causes. So some of the things that I started learning about and thinking about more were topics like chronic inflammation. That is one of the drivers of our most common chronic diseases, right? And where is that inflammation coming from? And how can we lower our inflammation in our body so that we can help to prevent some of these conditions, better manage some of these conditions, or reverse some of these conditions? Topics like insulin resistance that are so prevalent, right? So insulin resistance affects the majority of American adults, but most people have no idea that they have this, because most people have insulin resistance for years or decades before it manifests into a diagnosable disease like type 2 diabetes or prediabetes, right? So really understanding the why. Why did insulin resistance develop, and how can we prevent and reverse it? Because we know it's preventable and reversible for most people. Topics like gut health, right? So we know that our gut microbiome is very much related to our immune system, to our levels of inflammation, and even to our brain health, our mood, our cognition, our memory. How can we improve that? Why are we having issues with our gut health? And really like connecting the dots. I think that, for many people, they're told, oh, you need to eat better, you need to exercise, you need to lose weight. But really connecting the dots between our lifestyle and these root causes, and then the symptoms that we're experiencing, I think is so we're and life-changing. And it was for me. And I know that for so many of the people who've gone through my programs, it is for them too, because we're not ever given that type of help to understand why. And once we understand why and how, then that empowers us to feel better.
Yeah, 100%. And, I think one of the things that I'm hearing most and that I appreciate you really sharing is this idea of root cause, right?
Mhm.
There's always something happening underneath the hood inside of our physiology. And one of the things that I've learned personally along my own journey is how wildly interconnected the body is, right? Like we
Mhm.
cannot be looking at symptoms and organs in isolation. Like it really is this ecosystem where so much is affecting one another. And I love that
Absolutely.
you're teaching on that and you're talking about that and you're really helping others understand through your own experience, but also through your personal education that you've expanded on, like really what we have to understand. And that's the why, right?
Yeah.
So I love that you're sharing that and how important it is. I am curious, Dr. Saluja-Sharma, what do you feel like is maybe the biggest root cause issue that we overlook in traditional healthcare? Do you feel like there's one glaringly obvious one?
Um, I would say two. So, well, gosh, I don't know. It's hard to say, but because everything's related,
Yep.
right? So inflammation, insulin resistance, and gut health are really like huge, right?
Yes.
And they're all interrelated. So, I think that's those three issues can drive so many of our most common chronic diseases, whether
Yeah.
it's cardiovascular diseases, so like heart attacks, strokes, that's very much linked to inflammation, um, autoimmune disorders that can be linked to our gut health and inflammation. Um, just type 2 diabetes, which is so common, and that's driven by insulin resistance, which is driven by inflammation. So, all of those combined really are essential to understand because we can actually do something
Yeah.
for all of those things. We can lower whole body inflammation, we can improve our gut health, we can potentially prevent and reverse insulin resistance for many people.
Yeah, and that's something that's so important for people to really understand because I think what can happen sometimes in our systems as they're laid out right now is we kind of assume like this is just how it is, right? There's not a whole
Mhm.
lot I can do. And that's the thing that I love most about what you're teaching is we can really move into this preventative mindset and there's so
Yeah.
much that we can do. So I kind of want to move into that section of the conversation and talk a little bit about what can we do, right? So like if you have someone that you're speaking to and they have different kinds of symptoms they're managing. They're fatigued, they are bloated, they, don't understand why they feel so depleted all the time. Maybe they have things like inflammation, they're on the road to type 2 diabetes. What are the actual tangible things that you teach or share with your
Mhm.
potential clients, patients, or people you're talking to actually help them start to move the needle in the other direction? We'll get back to our conversation shortly after this message. If you are an overwhelmed and completely confused mom who just wants a simplified, easy to follow, and understandable plan when it comes to their health and wellness journey, then you're in the right place. As a wellness coach, I focus most on empowering women to follow a highly personalized and bio-individual plan that actually gets you results and that feels sustainable for your longevity. I'd love to invite you to set up a free coaching call to talk about your health and wellness journey. Head to erinshire.com/coaching to set up your call today. Again, that URL is erinshire.com/coaching to set up your call. And to make it even easier, head to the show notes of this podcast and click free coaching session to set up your call ASAP. Now let's dive back into the conversation.
Absolutely. So, lifestyle medicine focuses on 6 pillars of our health and really making positive, meaningful, sustainable changes in each of those pillars. It all works together and to help people prevent and reverse disease. So, the 6 pillars are what we eat. And so, the idea there is eating more whole foods and eating more plants.
Yep.
And so, that doesn't mean that you have to be vegetarian or vegan. Again, in our diet culture, I think a lot of times like recommendations are very concrete and extreme,
Yeah.
and that leads to for people, to not really be able to sustain those types of lifestyle behavior changes. But the idea is just to try and eat more whole foods and more plants, and whether that means um, that you're totally vegetarian or vegan or 80% or 50%, at least just sort of moving in that direction. Increasing physical activity. So that doesn't mean necessarily, needing to go to the gym and exercise 6 times a week for an hour, that it's like not sustainable, but just getting more movement into your life. So however that may be, and even adding 10 minutes a day of movement can make a meaningful difference. Stress. So there's two ways that I like to think about this. So it's kind of looking at your life holistically and trying to reduce stress, but then also understanding that stress is inevitable. And
Yeah.
so learning how to better manage stress. And that would be through mindfulness. And so I look at mindfulness as kind of three layers. So, and this is what we teach in my program, but mindfulness is a state of mind. So being less reactive to your daily circumstances. So being more deliberate in your reactions. Mindfulness as an informal practice. So being more uh, aware of what you're doing and not multitasking, just kind of like being in the moment. And then mindfulness as a formal strategy, so like yoga and meditation. And then improving our sleep, so both the quality and quantity of sleep, so recognizing that sleep is so vital for our well-being and our physical and mental health. Relationships, understanding that relationships drive our physical and mental health, and are the strongest factor that determines our longevity. And then the sixth one is reducing risky substances. And so that means drinking alcohol only in moderation or not at all, not smoking, not using drugs. So making positive, meaningful changes in each of those pillars can really make a huge difference.
And it does. And,
Mhm.
the thing that I appreciate that you're really speaking about is the basics, right? The foundations of what really serves our day-to-day health and our
Mhm.
longevity. And that's something that I think, especially in diet culture, has really gotten lost in some
Oh,
capacities,
absolutely.
right? Like with the extremes that you spoke about, or with the fast track kind of one size fits all strategies that don't speak to or work for every person. And so the way that you're teaching in these six pillars and helping people kind of adopt what's going to work for you in your life, and how do we
Mhm.
make this fit into what's realistic for you, like that is what's so empowering, right? That is what helps people really start to make shifts in their health and wellness. And so I love that you're speaking about that. One of the things you also talked about was how passionate you are about making resources like this,
Mhm.
functional medicine knowledge, lifestyle medicine knowledge, a little bit more accessible, right?
Absolutely.
Because the unfortunate and the hardest part about this incredible information is right now it's not covered by our insurance. It's not something that we're reimbursed for. It's not like the mainstream standard of care. And that's something that breaks my heart,
Yeah.
right? And it sounds like, based on the work you do, that that's something that you're passionate about too. Like you really want more people to have access to this incredible information so they can see how it can transform their health. So talk a little bit about what you've done to make it more accessible and how you've really helped kind of bridge that gap.
Absolutely. So, yeah, unfortunately, for people who they hear this and it resonates with them, and then you go and look for a functional medicine doctor that you can see, it's really expensive. And then you look at functional lab work that's often ordered, and it's so expensive. It can be hundreds, thousands of dollars to get an evaluation, to get a workup. And then often there's supplements that are recommended, and those can quickly add up. So, I mean, it's so expensive a lot of times when people seek this type of help, but it doesn't need to be. And that is what I'd love to share with people, because yes, seeing a functional medicine doctor can be helpful in a lot of circumstances. The lab work can be helpful in some, there can be some indications, and there's sometimes that supplements are indicated, but not necessarily for everyone and not for most people. And so really understanding the root causes is the first step. And so that's what I provide. I've created an online program, and that's what I created for initially for my corporate wellness programs, is this learning program to teach people all of the information that I found so eye-opening. Like, what is the root cause of high blood pressure, and what can I do to reverse that?
Yeah.
And what are some of the root causes of type 2 diabetes and insulin resistance? And what can I do? What is causing the non-alcoholic fatty liver disease or metabolic associated fatty liver disease, which 1 in 3 people in
Yeah.
the US have? What are things that I can do? And so I have kind of a step-by-step plan that I give to um, the participants of my program. So the idea, my program is called Head, Heart, Hands. So head is learning and mindset. So teaching them about all of these things that I think is so important, helping to create a positive mindset about their bodies and about food, which is fundamental in order to create change,
Yeah.
giving them the resources to create new habits and skills. And that's the heart, that's through the coaching and through, I have online coaching modules. And then
Yeah.
the hands is the tools, like
Yeah.
giving people recipes, meal ideas, exactly what do I need to make for dinner tonight?
Yeah.
What can I make? I work a long day. I'm
Yeah.
tired. How can I actually put this into practice? And so
Yeah.
that's what I do with my corporate programs, which has been so successful for so many people. And so then I've put that all into an online program for adults
Yeah.
to make it accessible for them. So you don't need all of the lab work. You don't need all of the supplements. For most people, just the basics and understanding why and having a step by step plan to help them
Yeah.
can actually be transformational.
Yes, it can be transformational. And the thing that I appreciate most is this reminder on the basics. And I
Mhm.
think again, this can get really, really lost in the health conversation. And I know in a lot of the conversations I have with women, like especially in midlife, like that's really who I serve, midlife women who are really experiencing a lot of shifting, a lot of hormonal fluctuations, things that they used to do don't work anymore. And so they start to kind of get into these habits of like trying all the things and taking all the things and going to all these extremes. When in reality, what really needs to happen is this slowdown of getting back to the basics, right?
Mhm.
And really figuring out how do you nurture what you need on a very basic health level first and start to master that as much as you can. And then if at some point you need to optimize in some way or get some more targeted data, amazing. But the basics can never be skipped. Like the foundations matter the most. And I think for whatever reason, like we've kind of lost that in the health conversation. And I love that you're really bringing attention to that and calling attention to that the most, because that's really what is the most transformative. And I just appreciate that so much.
Thanks. Yeah, no, I think it's so important because that's the basics and our lifestyle, our diet, all of that stuff. That's really going to move the needle the most, not a
Yes.
supplement.
Yeah.
Um, Not to be cynical, but I think the reason that a lot of these other interventions are pushed so much is because they make more money,
Yep.
so that's actually how a lot of influencers make
Yeah.
money,
Yep.
especially in the wellness space, is by selling supplements. And so really, like, unfortunately, it's challenging to know who and what to believe and
Yep.
what is necessary and what's going to help you when you're not feeling well. And so there's a lot of people out there that take advantage of that.
Yeah.
And it doesn't have to be super expensive. It's really, like, there's lots of ways to move the needle and to empower yourself that don't require a lot of money.
Yeah. Yeah. And it's good to be reminded of that, because I think, again, the conversation can go so wide and so deep, and it just really is dependent on your individual journey. But so often it really is about getting to the basics
Mhm.
again, right? In a very simplified way,
Yeah.
and really starting to master those things first. And again, I appreciate you sharing that, because I think it's something that people can't hear enough, right? We have to be reminded of that over and over and over, especially in a super noisy culture where we have a lot that's being shared or thrown at us all the time. And so it's just really refreshing to hear like the basics are really where it's at. Like it's really a profound thing. And I know one of the things you talked about is the success that you've seen with the people that you've worked with your corporate wellness clients, other people that you've kind of served. I'd love to hear, like, when you say success, talk to me a little bit about what you've seen happen for the people that you've helped. Like, what are the shifts? What are the wins? What are the things they've been able to resolve?
Yeah, so there's been a lot of people that have gone through my program that, they start out and they just feel kind of hopeless, that they are suffering with all these symptoms. They haven't, just don't know what to do. And so people that have had diabetes for years, or high blood pressure, or high cholesterol, or on multiple medications, people with chronic pain, people who are just exhausted, physically exhausted, and people with autoimmune diseases, just all sorts of issues. and they start making changes to their diet and lifestyle according to I have a 14-step plan, and they start making positive changes. And then soon, some of the people, the first thing they notice is, oh my gosh, I have more energy.
Yeah.
Oh, I have less pain. Oh, wow, I used to have this pain in my shoulder or this pain in my hip that used to bother me all the time, and I'm not having that anymore. Or, oh, I don't need to go to physical therapy for my knee and get the knee joint injections. And that's inflammation. So the first thing I think people start to notice is when you have reduced inflammation
Yep.
in your body, that's going to help with your energy, that's going to help with your pain. And so for many people, that's the first thing, right? And so, and it's like within weeks that people notice that.
Yeah.
And then going forward, as you start feeling better, then it's like, oh wow, I want to continue this. This is great. Like I'm actually feeling better, because that's really the motivator more than, oh, numbers on a scale. It's like when you're feeling better, then that's like everything, right?
Yes,
And
everything.
so then people eventually do start noticing, oh wow, yeah, I am losing weight. Like the numbers on the scale, that is moving, and maybe my pants are fitting differently. And then for many people who've gone through the program and they did biometrics before and after the program, where they saw their doctor, and I've had people reverse their type 2 diabetes in even 12 weeks. Multiple people who've been able to come off of their cholesterol medicine after just 12 weeks. People that their blood pressure has gone down significantly. One of the participants of the program, she had type 2 diabetes, high cholesterol, and high blood pressure. And she was frequently needing to go to the ER because of blood pressure
Wow.
emergencies.
Wow.
And by the end of the program, she was able to come off of her cholesterol medicine. Her doctor said that she was really close to coming off of her diabetes medicine. It was really, if she continued the lifestyle, that she would be able to come off of it. And her blood pressure was better than it had been in decades.
Wow.
Like, so these blood pressure emergencies were no longer happening. And it's kind of amazing that, after years and decades of people struggling with things, that then they start making these changes and they're so empowered. And so many of the people that have gone through my program, then they've said, like, why am I just learning this now?
Yeah.
Right? Like, why, if this was so doable for
Yeah.
me,
Yeah.
why am I just learning this now? And that's why I ultimately decided to write the children's book series and
Yeah.
to focus on nutrition curriculum for kids, because the truth is, it's never too late to make positive changes, but the earlier you make them, the better. And it's possible to prevent many of our most common chronic diseases. And so if we can start early, then it can really make a massive difference for children and families.
Yes, it can. And the one thing I want to quickly recall, because I think this is the most profound takeaway that I want people that are listening to this conversation to have, is you're talking about wins like reversing type 2 diabetes, getting off cholesterol medication, nearly getting off blood pressure medication, like feeling better, reducing inflammation, all of these incredible wins. And they're all based on very basic principles, the 6 pillars you talked about, with just moving more, eating whole food nutrition, learning how to stress manage, learning how to protect your sleep, pouring into positive relationships. Like all of these things are totally doable, to your point. And I like people to continue to hear this over and over and over, because I don't want people to take away this idea that it has to be this really crazy, confusing process. Like there really are manageable things we can do every single day to transform our lifestyle. And I just can't get enough of what you're teaching, because it's just something that I want more and more people to hear as often as possible, because it's just so important. And I love the wins. That's so awesome. Like so many incredible wins, so many health shifts and changing of the trajectory of their life, which is just awesome to hear. And I know one of the things we've also talked about that you shared is, moving into writing your children's books and educating children, getting into the school environment, et cetera. And so I want to kind of shift into talking a little bit more about that and hear your heart a little bit more around why you feel like it's so important to really educate our youth and educate generations to come, and what we can continue to do as parents, as caregivers, to also be a part of like amplifying that message and helping them learn too. Like, what can we collectively do, in your opinion?
Absolutely. So, we have an epidemic of chronic disease in the US in
Yeah.
adults, but unfortunately, the rates of chronic disease in kids is increasing too.
Yeah.
And so many of those same root causes of our health, it affects our children too. So, children, for many kids, they're developing conditions like insulin resistance or inflammatory conditions, or they're, you know, eating their lifestyle is not aligning towards a healthy gut.
Yeah.
So there's lots of, I think it's important that we target that early, because it can really make a big difference both in how children feel now and
Yep.
then also their future.
Yes.
So when we create positive change to our lifestyle now, again, just as adults, you can really, there's a noticeable difference that people can feel almost immediately, but then again, it can change your future. So I think it's so powerful to recognize that. I think that for many of us, we think that kids are so resilient, right? Like kids, look at kids menus out there. You go to any restaurant and the kids menus, the food that's available for kids, even at the nicest restaurants for adults that are healthy, for kids it'll be like chicken nuggets and french fries, and we think, oh well, kids, they can deal with that, they're fine, they're not going to have an issue, but it affects them.
Yeah.
And so I think it's important to really understand that the lifestyle and diet that our kids have now really impacts how they feel now, but also impacts their future. And then
Yeah.
I also think it's important to really establish a positive foundation on how kids see food and
Yes.
see their bodies, because I think that ultimately really sets people up to fail. So in our diet culture, for so many people that are struggling with their weight or with chronic diseases, they are in this cycle where they're dieting and they, maybe have short-term success, and then they eventually, can't keep up with this crazy diet lifestyle, and they give up. And I feel like that culture really sets us up to fail, this diet culture. And I think one of the most meaningful things that I do with adults is to really change the way they think about food and change the way they think about their bodies. So thinking about food not as just something that you eat that will make you gain weight, but thinking about food as our most powerful medicine, and being able to harness that power to make to change the trajectory of our life, right? So harnessing the power of food. And then similarly, thinking about our health as more than just our weight, numbers on a scale, but thinking about our health in terms of our energy and our mood and feeling stronger. We want to feel stronger physically and mentally, and those being our goals. And that's what we're striving towards. So,
Yeah.
really sort of changing what we are aiming for and changing the way that we think about it. And I think that, in addition to the root cause way of thinking about our health, is really transformational. And that's what I think is important to establish in kids,
Yeah.
because if you can start out thinking about food as miraculous and amazing, and understanding how food can help you feel your best, then
Yeah.
that's so much better than most of us, right?
Yes.
So
Yeah.
I think that our diet culture really creates a negative relationship with food for most people, and so really, like, trying to create a positive foundation there can change our life. And similarly, a positive foundation on how we see our bodies, really
Yeah.
like feeling empowered.
Yeah, and you hit the nail on the head. I think, the nutrition and food discussion is very interesting. I would say, especially inside women's health, and a lot of the
Mhm.
stories I hear from women, and even my own story, like there really is a lot. There are a lot of layers to this idea of what is food, how do I eat food, what should I or shouldn't I eat, like all of these crazy narratives
Yeah.
that have been born out of a lot of extreme messaging, diet culture messaging. And it's so important to really continue to normalize these conversations and help people feel like they can be empowered around food and really understand how it can energize your body. And it's so nourishing, and it can change how you feel day in and day out. And not only that, but also your longevity and, how your quality of life is for years to come. And so I really love that that's a part of what you teach kids and families and all of the people that you work with, because that is a foundational component. And I know it's something that a lot of people struggle with. So thank you again for kind of sharing that. One quick question before we kind of move into wrap up. We've talked a lot about your journey and how you've come, like you started in emergency medicine and you moved over to lifestyle and functional, and you've seen a lot of different sides of the healthcare system, right? You've seen in the healthcare system, kind of out of the healthcare system, and now doing a lot of the work you do with head, heart, and hands and all of the things. I'd love to know, in your opinion, what do you feel like is one thing in today's healthcare system that needs to be better, right? That needs to be changed? Like, what would that be for you?
So again, I think disease prevention and reversal. So really focusing on the root causes and empowering people with knowledge and giving them the knowledge, the support, and the tools to help them make positive change. And so I feel like I'm doing that at a small level right now, like whatever I can do. But in order to make positive change, in order to prevent and reverse disease, it requires a few things. And that's why my program is holistic. You can't just know what to do,
Yeah.
but that's the first step. The first step is actually knowing what to do. And then you have to feel supported and feel hope that you can do it.
Yeah.
Then you have to develop those skills in order to make positive change.
Yeah.
And then you have to have the tools to do it. So I
Yeah.
think like creating more programs like mine, honestly, that give people all of it, the head, the heart, the hands, to really change their life. Like, I think that is what is needed. And there's so much controversy about, our healthcare system and about insurance and coverage and, all this stuff, but really like getting to basics and helping people prevent and reverse disease is really what's going to help to heal our healthcare system, because we have a epidemic of chronic disease. And unless we get to the bottom of that and help people, then it's really, our healthcare system is just not sustainable.
Yeah, it's not. And, I appreciate just your perspective as someone who's really seen a lot of different sides, and just this idea of how do we get into disease prevention? Like, how do we really change the conversation so we're in a preventative mindset? And beyond that, like giving people the tools in order to do that. And so I'm grateful to be connected to you, Dr. Saluja-Sharma, and the work that you're doing and the way that you're filling the gap and helping make education like this more accessible is just tremendous. And I can't thank you enough for being here today. Will you quickly share how people can find you, connect with you, find your books, learn about your program? Where are the best places to find you?
Yeah, thanks so much. So you can find me online. So I am on Instagram and I'm on Facebook. I'm Head, Heart, Hands MD, and I try to share valuable health tips almost daily. And then my website is headhearthandsmd.com. And you can find out more about my online program for adults, about my children's book series, which I think is not just for kids, but the idea is it's for families to really help kids and families make positive changes together. And I think that's a great way for families to start, right? Doing it together. Those books are available on Amazon and Barnes & Noble. The book series is called The Wonder of What We Eat. Yeah. It's a book, a workbook, and a cookbook.
That's so cool. And we'll make sure everything is linked in the show notes. So if you're interested in getting connected to the books, getting connected to Dr. Saluja-Sharma's course, or anything that she's doing, please make sure that you go to the show notes and connect with her. And thank you again for your incredible expertise and time today. I'm so grateful.
Awesome. Thanks so much for having me on the show.
Sure thing. Take care. Thank you so much for tuning in to today's episode. I know balancing time and energy can be a challenge, and I'm so proud of you for listening in and investing in your wellness journey. I feel incredibly grateful to connect with you and for the opportunity to share more knowledge, stories, and encouragement related to all things wellness. I would love to hear how this podcast has served you. If you enjoyed today's episode, please subscribe and leave a review on either iTunes or Spotify. Your support truly means the world to me and helps me reach more women just like you and me who are looking to transform their health from the inside out. Plus, when you share this episode with a friend, we invite more women in to learn alongside us. What a gift. Remember, knowledge is power, and the more we know, the better we can do. For ourselves, for our families, and our future. Well done on taking the step towards a healthier, happier you. Until next week, stay empowered and stay well.